You heard a bit of it there. The Gazan Health Ministry, which is run by Hamas, of course, has said today that 12 hospitals and 32 health centres have been forced to shut down due to a lack of fuel. Dr. Mohammed Abu Mughaisib is with Doctors Without Borders, Deputy Medical Coordinator in Gaza. He joins us now. Doctor, tell us more about the current situation that these hospitals in Gaza are facing.
As you mentioned, the hospitals now, I think they are working for I'm sure that they will soon shut up because of the fuel. They're running on generators. And for example, yesterday, one of the hospitals stopped working for half an hour, and they were trying to find fuel to run the generators, one of the hospitals in the north area. The situation, I'm sure that it will collapse very, very soon in the coming hours. The hospitals are super crowded. It's not hospitals anymore. It's shelters. You cannot distinguish between ICU, emergency department, gynecology. It's all mixed departments. Everyone, all patients are mixed. There is lack of a lot of drugs. This shortage was before the war. The hospitals were suffering of shortage of drugs and disposables before the war. Now with the war, they are, as our colleague before me, he mentioned that they are operating without anesthesia. There is a lot of shortage of drug. There is no painkillers. There is no operative care. There is no RPC measurements. It's really a catastrophic situation in the hospitals.
Operating without anesthesia. That sounds truly horrific. What do you think is a timeline on getting more medications into Gaza? We've seen this hold up at the border with some of this aid. Do you think if there's more aid can get in, it can sustain the hospitals?
I hope so. That we are counting on this aids and the trucks that are entering. Until now, all these trucks, they are not enough. Most of the trucks were not medical aids. I heard that there were 2 only medical trucks full of aids. They didn't reach the hospital yet. They were not distributed to the hospitals in Gaza City and the north area. They were distributed only in the south. We are as well, MSF, Doctors Without Borders, we have some trucks that we would like as well to enter, to coordinate to enter, but we don't know when and how. The situation is, I think, every minute the situation is really, I don't know what to say, but the hospitals can turn to graveyards.
No, I can hear in your voice, I can see in your face, it's a desperate situation. And these hospitals as well are being used as shelters. People feel that the hospitals are the safest place that they can get to. Talk about that, because these places are not just locations where people access medical care if they can get it. They also just feel safe in these buildings, right?
For example, the Shifa Hospital in Gaza City, which is the main hospital for Gaza, there is around 60,000 people sheltering there. In the corridors, in the parking, everywhere except the operating room, there is no shelter. But everywhere there is people sheltering. They are putting tents, parking. It's in all hospitals of Gaza, and this is an example, Shifa Hospital. For example, in the south, there is around 40,000 people in Nasser Hospital, which is the main hospital in the south area of Gaza. Everywhere in Gaza now is a shelter. It's not the hospitals, the schools, the shops, the streets.
Yeah, with so much destruction, it seems that people are just trying to find any way they can go for shelter. Everywhere in Gaza is a shelter. Thank you for being with us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.